So the first thing we're going to show you is some of the reports that we've got. We have a set of reports under reporting. So if you go to reporting at the top, down to clinical reporting, and when it opens, if I just scroll to the top of my list, you'll see a folder called Ardent Limited. If that's not expanded, if you expand it, scroll down the list until you get to a folder called Vaccinations. And in that folder you will find a set of folders for the seasonal influenza vaccinations, and the first one there is called Review Before. So these reports have been put in place to help you look at your patients before you invite them in, hopefully. So the first two are PSD reports, but we'll come back to those in a minute. So for review before ordering and invitations, obviously the orders have already gone in. The orders would have been in since last year, probably in some cases, but these may help you for next year's ordering. So the first one there, aged less than 18 and aspirin in the last 6 months, there is a contraindication for that, so that's why that report is there. Again, you need to get your clinicians to look at those patients to check those out before you invite them in for a particular type of vaccine. The next one, check as influenza, allergy, anaphylaxis. So there's been a previous recorded allergy in the patient's record, so those need checking before you invite those in. It could be that it was an error, or it may no longer be a case that they have an allergy, so that they can be invited in quite safely. Then we have a report to show patients that are in care homes. So it's important each year to do a bit of a tidy up on the care homes. Patients in care homes get marked with a local residential institute code, which unfortunately we can't set up reports for. We can only report on read codes. So there is a separate support article which is linked from the flu clinic's support article, which shows how to tidy those patients up. But if they're not coded, then they won't get pulled into the main reports. Check if patients are still housebound. So lots of patients get coded as housebound, and perhaps they're not permanently housebound, just temporarily, so they should be taken off the housebound register. So some patients you have coded with housebound might get invited, but they don't actually, they're not eligible to be housebound anymore. You may also have patients who have become housebound who haven't been coded, so it's worth getting your GPs and nurses just to check their lists of patients. Check if patients are still pregnant. So this does cause a few issues each year, where some females are recorded as pregnant, and then for whatever reason there's an issue during the pregnancy. They maybe have a miscarriage or something else, and it's not recorded properly in the record. They're still marked as pregnant, and then they get an invite in the post, which can be quite distressing for the patients, and obviously cause complaints to the practice. So it's worth a check of that register to make sure that those patients are still pregnant, and the coding is correct. Medications from hospitals is also an issue, and it depends how these are recorded as to whether we can pick these up in the reports. So again, you can break this down, you can look at the issues of medications, and get your GPs to look at those. And then we have 4 reports that are looking to add the 90X4 code, which is the code that makes patients eligible for a flu and for payment. And as in previous years, that code should be added after the 1st of September. If it's added before then the business rules don't pick it up, or may not pick it up. So the first one there, if vaccination indicated as a carer, not in another risk group. In previous years, we've discovered that the carers are not automatically included in the business rules, although they should be. So that's why that report's there. So you may have to code your carers with 90X4 again this year. We're not sure yet. If vaccination indicated as coded in previous years and not in, oh, excuse me, just extend that. in an age or a risk group. So in previous years, you may have coded patients with 9OX4 because there was a clinical need to vaccinate. And again, this year, those patients may not also fall into a risk group this year. So those patients should really be reviewed again to see whether they should have their vaccination again this year. And because they're not in a risk group, again, this year, that code 9OX4 will have to be reapplied. And then the next one, we've got vaccination indicated as COVID-19, moderate high risk, without a more recent low risk, and not eligible. So some of the patients you have coded with moderate or high risk for COVID-19 don't actually fall into one of the usual flu risks. Most of the patients do, but some of the patients won't. Therefore, there will be a small number of patients you need to look through, and if it's considered clinically appropriate, then they need to be coded 9OX4 as well. As in previous years, we've already had reports that multiple sclerosis seems to be one of the areas that's missing from the business rules again. So there's a report there to identify patients who suffer with multiple sclerosis who are not in another risk group, who should be reviewed, and again, if it's clinically appropriate, then they should have the 9OX4 code applied. And then going down the list a bit further, we have considered contacting those given by other provider last year. So this is giving you the opportunity to chase all the patients who went elsewhere last year to pharmacies to have their flu vaccinations, and try and increase your practice uptake and obviously practice income. Consider recording splenic disorder, if appropriate, as infectious mononucleosis, I think it's called. So this particular condition should really, or potentially should, have a recording of a splenic disorder. That would then force them into the correct risk groups. And the last one there, record mobile number. We have an SMS consent perhaps on the patient, but for some reason there's no mobile number recorded. So maybe it was recorded in the past, it's been taken off, and the consent is still on there. You just need to chase the patients for these, and if it's still appropriate, if they still give their consent, and record their mobile numbers, and then you can use those for the invites and everything else.